Assalamualaikum. I bid to Madam Farah Ayuni. So today, me and my friends will presenting about the analysis of coping strategies of academic stress among the UniKl students. So I will be presenting my members of this group. So the member of this group is first Nur Fatin Humaira binti Azli, next myself Nur Husna binti Helmi, and Nick Aimin binti Nick Asmai, Muhammad Aris bin Zainat, and Sofia binti Ghazali. So we will be presenting the first chapter, which is chapter 1, which is introductions. First, background of the study. Medical education is universally known to be extremely demanding with a high workload, intense academic expectations, and long hours, and this pressure often lead to a significant stress among the medical students. Research by Smith and Young in 2021 found that this stress can negatively affect the student mental health, leading to the condition like anxiety, depressions, and even burnout, which in turn affect both personal and academic performance. Among the main stressors are academic competitions, fear of failure, and the pressure to perform well in both theoretical and clinical setting. According to Lazarus and Foltman, coping is how individuals respond to stress. Adaptive strategy like time management or social support can help. But many students, as Kumar highlighted in 2019, resort to harmful methods like avoidance or denial. Unfortunately, many are unaware of effective coping methods or face stigma or lack of access to support system, making the situations worse. The way students cope now doesn't just affect their studies, it shapes like their future as healthcare professionals. Sharma and colleague in 2022 stressed that active coping today reduce the burnout and improve the future competence. This study aims to identify the coping strategies used by the medical students with the goal of designing better support system that promotes the mental health, resilience, and long-term success in the both academics and professional life. So next slide, I will be presenting about the problem statement in this report. So the medical students are among the most affected when it comes to academic stress. The combinations of demanding curriculums, long study hours, and clinical responsibility often leads to burnout, anxiety, and depressions, as shown by the Dearby and colleague in 2017. Students do try to cope. Some use healthy methods like seeking social support or problem solving, but others rely on less effective techniques such as avoidance or even substance use, which can make the stress worse, as Roth found in 2016. This problem is that although many coping strategies exist, we still don't fully understand which ones are actually being used by medical students and more importantly, how effective they really are in a such high-pressure environment. Factors like students' cultural background, personal experience, and the kind of institutional support available all likely play a role. But these areas haven't been explored deeply enough, according to the Lavelle in 2020. Furthermore, while wellness program and mental health resources are increasingly offered by medical schools, like Slavin in 2014 noted that these efforts are rarely evaluated properly, which limit their improvement and effectiveness. By identifying which coping mechanisms work best and are most used, institutions can design more targeted and impactful intervention. This is critical for building mental resilience in future doctors, both for their well-being now and in their future medical careers. So, for the next slide, which is the research objective. So our objective in this study is guided by three main objectives, which is first, we aim to determine the level of academic stress experienced by the student at UniKl RCMP. Understanding how stressed students feel will help us establish the severity of the issue. Second, we want to assess the coping strategy used by the student based on their socio-demographic characteristic such as age, gender, year of the study, or living arrangement. And this can help to identify the trends or difference among the students groups. Finally, we aim to find an association between coping strategies and healthy lifestyle factor. In other words, we want to explore whether habits like regular exercise, sleep patterns, or nutrition are related to how students manage academic stress. And these objectives are important for creating more focused and effective support system for our student well-being. So, next slide. And the research question that we have prepared, which is this research is structured around three central questions. First, we ask how do social demographic factors such as age, gender, and year of study influence the coping strategies that students use. And this helps us understand whether personal or academic background play a role in how students manage stress. Second, we explore is there a significant relationship between coping strategies and healthy lifestyle practice like regular exercise, enough sleep, or maintaining a balanced diet. We want to see if healthy habits support more effective stress management. And third, we investigate which type of coping strategies, whether problem focused, emotion focused, or avoidance based, are most commonly used, and how effective do students find them in reducing academic stress. This question aims to provide a deeper understanding of how students handle their stress and what support they truly need to succeed academically and stay mentally healthy. So for my last part, uh, which is limitations of the study. While this study offers important insight into how medical students cope with the academic stress, there are several limitations to consider. First, the study was conducted only at the UniKl RCMP, so the finding may not be fully representative of students at other university, where the environment and support system might be different. Second, since the data was self-reported, students may have left uncomfortably being completely honest about their coping behavior, especially if those behaviors are viewed negatively, like avoidance or substance use. This can affect the accuracy of the result. Third, this is the cross-sectional study, meaning it only captures a single moment in time. It doesn't show how student coping strategies might change or evolve as they move through different phases of the medical school. And lastly, although we look at the healthy lifestyle habit, the student did not include all the potential factors that can influence mental well-being, like personal traits, history of mental health challenge, or family and social support outside the university. Future research should consider those areas to build a more comprehensive understanding of how to support the medical student effectively.
So my name is Sofia Hidayati Ghazali. I will continue the presentation with chapter 2, which is about the literature review on the academic stress. Okay, 2.1, which is about the understanding about the academic stress. So basically, academic stress is the mental and emotional strain resulting from academic demands and expectations, including exam, assignments, heavy workloads, competition, fear of failure, and also time limitations. And next, impact on well-being. So based on Misra and MC King 2000 state that academic stress can harm in students' academic performance and overall well-being, contributing to issues such as anxiety, depression, sleep disturbance, and reduced self-esteem. And next, about the external pressure. Academic stress is often hated by expectations from family, society, and the student themselves, resulting in a high-pressure environment. And the next is performance-driven culture. So based on Robotham and Julian 2006, suggests that contemporary education focus heavily on performance indicators, promoting a culture that values achievement over student well-being and thereby increasing stress levels. Next. Okay, next 2.2, which is about the causes and risk factors of academic stress. Okay, so first, internal and external factors. Academic stress arises from both internal and external factors, such as perfectionism and inadequate coping mechanism, and external factors including heavy academic workloads, limited support, and strict schedules, and also peer pressure. And next, common student stressor. Based on Shankar and Park 2016, highlight that major stressors such as insufficient leisure time, lack of sleep, and vague academic expectations, particularly in intensive disciplines like medicine and engineering. And next, socioeconomic and cultural influence, which is financial challenges, family responsibilities, and part-time jobs will increase stress levels, especially for students from lower socioeconomic backgrounds and collectivist cultures. Next. Okay, so 2.3 about the coping strategies and overview. So types of coping according to Lazarus and Folkman, 1984. Coping strategies are divided to problem-focused methods such as time management and seeking assistance, and emotion-focused method like venting and relaxation. And next, mixed strategy use. Students frequently use a combination of both coping styles depending on their individual characteristics and the specific stressor they face. Next, scope inventory. So based on cover ATL 90 and 89, identify that coping strategies such as an active coping, planning, and religious coping, while noting that avoidance tactics may negatively impact long-term well-being. And next, importance of adaptiveness. Students who employ adaptive coping strategies generally will experience better mental health and academic success compared to those who depend on avoidance. And next. Okay, next. 2.4, the gender differences in coping strategies. So first, gender difference in stress. Female students generally report experiencing higher levels of academic stress compared to male students, which is influenced by social expectations and greater emotional sensitivity, based on method 2004. And next, coping pattern by gender. So women are more likely to engage in emotion-focused coping strategies such as seeking emotional support and self-disclosure, whereas men tend to prefer problem-solving approach and avoidance behavior. And next, effectiveness of coping. Females often talk about their stress with others based on Dyson and Rank 2006, but they rely too much on emotional coping without addressing problems can be detrimental. So males may underreport their stress, which can result in unresolved difficulties. And next, cultural influence. Traditional cultural norms often discourage men from expressing stress openly, which can restrict the use of effective coping mechanism. Next. Okay, next is 2.5, effectiveness of coping strategies in academic performance. The first, benefit of adaptive coping. Techniques such as problem solving, effective time management, and seeking support are associated with better academic performance and enhanced well-being, based on Elias et al. 2011. Next, risk of maladaptive coping. Behaviors like avoidance, procrastination, and substance use contribute to lower academic achievement, burnout, and a higher likelihood of dropping out, based on Park and Adler 2003. And next, a role of institutions. So we have to provide stress management programs, and coping skills workshop has been proven to improve student performance and overall satisfaction based on Steinhardt and Dolbear 2008. And the last one is academic and mental health link. So this encouraging healthy coping strategies is crucial for achieving academic success and building mental resilience, and should be an integral part of student support device services. So that's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh and very good morning. My name is Muhammad Arwis bin Zainal. So I'm going to present about the chapter 3 research methodology. Next slide. So first of all, our research sampling method is a convenient samplings, which means we will use the non-probability samplings method in this research, where the participants are selected based on their availability, proximity, and ease to access to the researcher. And then our goal is to gather the response from the student across the different programs in the UniKl RCMP and academic year for a broader perspective of coping strategies on how they cope with their stress. Our targeted group is, of course, the current student in the UniKLs. There is inclusion criteria that we give is that we provide is the students that will be answer our questions bid to register from the UniKL RSMP students, and they volunteer consent to participate in this study. And our inclusion criteria is the student not enrolled in the UniKL RSMP will not answer this research, and we will not answer the research. And then about the ethical considerations, we will in the Google Forms that we provide for sampling for questionnaire, we will inform the concerns for them to answer our Google Forms, and then they will the participants that answer are volunteer and confidential. So the study duration for the research is 16 April until 6 June 2025, and the data collection was done from 16 to 23 April 2025. So the methods that we use is the online questionnaire via Google Forms, and we'll distribute them throughout any social media and of course and WhatsApp. Next slide. For the research instruments, the type research instrument that we use is the self-administered questionnaires, which is we provide the Google Forms, and we will and the purpose is to assess the academic stress levels and coping strategies among the UniKl RCMP students, and we will distribute it through online via Google Form. For the questionnaire structures, we will it divided into 4 parts, which is part A, part B, part C, and part D. And for the part D is a socio-demographic info of the respondent, which they will tell their age, genders, and year of the study in this UniKl. And the part B is a knowledge of the healthy lifestyle practice on how they cope with their stress from their course. And then the item that we use for the questionnaire is from the brief copes. So what is the brief cope? Brief cope is a short version of cope inventory, which is widely used questionnaire developed by the Charles Carvers to assess how people respond to stress, and it evaluate coping strategy across the several dimensions, such as how they do the self distractions, how they coping how when they do the active copings on, or about their denials, so and or any substance that they use to coping with their stress. So all of this will be asked through this brief cope questions. And then part C, we were asking about the attitude toward the coping with the academic stress. And the part D last is an actual coping practice for behaviorals and lifestyles. So we will use the scoring systems, 5 points like scales from 0 to never, and the last mark is 4, which is every days. For the data analysis, the demographic data that we collect will be summarized by course, age, and also gender. So the coping response analyzed using the frequency counts that we analyzed in the chapter 4. And then we will compare by the groups, which is gender and also programs, on how they manage their stress for each program. And we will not using any advanced statistic tests like SPSS. And the result in the chapter 4, we will present it using tables and mind maps. And then we put also the descriptive summaries of their results. I think that's all from me. Thank you.
Okay, next, my name is Ni Aimi binti Ni Azman. I will be continue for chapter 4, which is regarding findings. Okay, for the first section, which is knowledge, the first question is, what is your main source of academic stress? So out of 134 respondents, exams were reported as the leading cause of academic stress by 97 participants, which is around 72%. So assignments followed as the second most common stressor, selected by 16 participants, which is around 12%, while peer pressure was chosen by 8 respondents, which is around 6%. So this highlights that exam-related anxiety is significantly more prevalent than other sources of stress. And then for the second question, which is how often do you feel academic stress? So among the 134 participants, we reported that around 65 respondents, which is 49%, said that they experience academic stress occasionally, which is around 44, equivalent to 33%, reported feeling it frequently, and lastly 70 responded, which is around 30%, admitted to feeling it all the times. Then for the third questions, which of these following techniques have you tried? So the techniques that we list out, which are deep breathing, time management meditation, study stretching, and avoidance. So when asked about stress management strategies, 44 respondents, which is around 33%, reported using time management. Meanwhile, 42, which is around 31%, mentioned study scheduling. And lastly, 23 responded, which is equivalent to 70%, answered practice deep breathings. For the next question, which is the fourth question, is, are you getting at least 6 to 8 hours of sleep most nights? So only 57 participants, which is around 42%, confirmed getting adequate sleep during most nights, while a larger portion, which is around 77 respondents, which is around 57%, stated they do not get 6 to 8 hours of sleep consistently. So this indicates a potential contributor to academic stress and burnout. And for the last question, for section 1, which is knowledge, is, do you eat regular balance during exam season? So just 59% responded, which is around 44%, reported maintaining regular balanced meals during exam seasons. In contrast, 75% participant, which is 56%, admitted to neglecting proper nutrition during this period, possibly due to time constraints or stress-related appetite changes. Then moving to the second section, which is about attitudes. The first question is, do you deal your stress by talking to yourself or keeping it to others? Keeping it to yourself. Okay, a majority of 76 participants, which is 57%, stated they keep stress to themselves, while in contrast, 55 respondents, which equivalent to 41%, preferred talking to someone as a way to cope to stress. So this indicates a tendency towards internalizing stress rather than seeking support. For the second question of this section is, do you feel more stressed during exams or during assignments? So an overwhelming majority, which is around 106 respondents, which is 79%, indicated they feel more stressed during exams, whereas 28 participants, which is around 21%, found assignments more stressful compared to exams. For the third question is regarding the ranking. So the respondent was asked to rank the following in terms of how effective they are in reducing stress, which the options include sleeping, studying early, talking to friends, avoiding distraction, and lastly exercise. So when asked to rank these stress reductions methods, 55 respondents, which is equivalent to 41%, chose sleeping as the most effective method. And another 38 participants, which is 28%, selected studying early, and lastly 16 respondents, which is equivalent to 12%, picked talking to friends. This reflects a preference of solitary, restful coping methods over social interactions. And then moving to the fourth question for attitude, do you feel do you often feel burnt out or emotionally drained? So the respondent, around 104 respondents, which is around 78%, reported feeling burnt out or emotionally drained, while only 30 participants, which is on around 22%, said they did not feel burnt out or emotionally drained. So this suggests a significant level of chronic stress among the students that were collected in our survey. And then for the last question for the attitude sections, which reads, my go-to stress reliever is, and blank space. So the top response for favorite stress relievers among the respondents were, the first one is listening to music or podcast, which collected to be around 39 respondents, equivalent to 29%. And then the second most chosen answer is watching TV or reading a book for fun, which are responded by 38 respondents, equivalent to 25%. And lastly is taking a walk or doing light exercise, which is around 22 respondents, equivalent to 24%. And then moving on to the last section, which is the third section regarding practice. So for this question, the respondent were asked to rank these negative stress effects in order of how often they experience them, which include lack of focus, headache, mood swings, appetite change, and lastly insomnia. So the most frequently reported stress-related symptoms were, first one is lack of focus, which were answered by 48 participants, equivalent to 36%. And the second most answered is headache, which is answered by 25 respondents, around 26%. And lastly is mood swing, which answered by 22 respondents, around 16%. For the second questions, it reads, I've been turning to work or other activities to take my minds off things. So when we ask how often they use this statement or distraction technique, so 57 respondents, which is around 42.5%, said they use this technique in a medium amounts. And then the second most answered is a little bit, which is answered by 37 respondents, equivalent to 27.6%. And lastly, 36 respondents, which is around 26.9%, admitted that they've been using these techniques a lot. And then for the third questions, it's, do you avoid procrastinating and stick to study plans? So for this question, the response were exactly split, around 67 participants answering yes, and whilst the other 67, which is 50%, said they do not stick to their plans. So this suggests a balance in self-discipline level within the group that we have collected. And then for the fourth question, which reads, are you supported by your friends and family? So a very high number of respondents, which are around 127, which is equivalent to 59%, felt supported by family and friends, whereas only 7 of them, which equivalent to 5%, reported a lack of support, which means social supports appear to be widely available as we collected this data, even if it's not always utilized for stress relief. And then for the last question, for our section 3, which reads, I manage my time by, the top 3 time management strategies that were collected were, the first one is breaking tasks into smaller manageable chunks, which are answered by 44 respondents, equivalent to 33%. And then the second most answered is using a planner or calendar, which is around 41 participants answered these options, which is around 21%. And lastly, chosen by 26 respondents, which is around 90%, is setting timers to focus on one task at a time. So that is all for Section 4. My name is Nurhati Marabati Azli, and now I will be presenting on the chapter 5, which is about the discussion on this topic. So for section 1, which is the knowledge, we go on the question, which is question number 1 is what is your main source of academic stress? And also how often you feel academic stress. So based on this chart and picture that we can see that the examination are the leading cause of academic stress as reported by the majority of respondents. Exam typically carry a significant weight in academic grading in all universities, while in UniKl, as this university is majority taking medicine related subject, they feel burdened as they need much more higher knowledge compared to other students to remember all the scientific terms and equation. The need to recall and apply a large volume of information in a limited time frame can be overwhelming to the students. And then most students answer occasionally as the exam season is not conducted at all the time, but students also feel burdened with the assignment and deadline, make the result is understandable. Based on the literature review from Robertham and Julian, the modern educational environment increasingly prioritizes the performance metrics, which lead to a performance-oriented culture and further intensifies the stress. And then for question number 3, which of these following technique have been tried? And from the literature review from Misra and McKee, academic stress not only affects students' performance but also their emotional and physical health. It manifests in various forms, including anxiety, depression, sleep disturbance, and low self-esteem. And the highest percentage among all the listed technique is the time management. So in academic settings, students often juggle and multiple tasks, including exams, assignment, group project, and also the club activities. Without the proper planning, these responsibilities become overwhelming, and then when the time management takes action in prioritizing the important tasks to prevent the procrastinating in the students itself. And then we move on to the question number 4, which is talking about are you getting at least 6 to 8 hours of sleep? The lack of sufficient sleep can impair the memory consolidation and reduce concentration, which cause the negative impact in performance and stress. And poor sleep weakens the cognitive function like memory, decision making, and problem solving, which all of these are essential for the academic success. Therefore, managing academic stress through healthy sleep hygiene is essential not only for academic achievement but also for maintaining the emotional stability and physical health. And for question number 5, do you eat regular balanced meal during the exam season? So based on this pie chart, we can see that most of the students are not getting a healthy meal during the examination because of during examination periods. Maintaining a regular and balanced diet is essential for supporting cognitive performance. However, the findings shows that most students do not practice healthy eating habits during the exam season, and this may be due to the time constraint, stress, or prioritizing study over meals. Skipping meals or relying on fast food and sugary snacks can lead to fluctuation in blood sugar, resulting in fatigue, irritability, and reduced concentration, which all these will affect the academic performance. And then we move on to the section 2, which talk about an attitude. So for the first question is, do you deal your stress? And for the second question is, do you feel more stressed during exam or assignment? For first question, most of the people respond that they like to keep it on themselves. And according to transactional model of stress and coping proposed by Lazarus and Folkman, coping can be categorized into problem-focused coping and emotion-focused coping. When individuals choose to keep their problem to themselves, this behavior is generally considered a form of emotion-focused coping, as the person tries to suppress feeling, avoid confrontation, or minimize stress in silence due to the fear of judgment or not wanting burden others people. And most of people feel stressed during the examination. And for question number 3, it's talking about the ranking of the following term of how the effective in reducing stress, and most rank sleep as the first choice as they believe the sleep demonstrate that many individuals believe rest is the most effective way to manage stress.
The popularity of this option may be attributed to how easily accessible and immediate it is. Because of time constraint and harder to implement activity like exercise, students most prefer the sleep because sleep can provide temporary escape from the stressor. And then we move on to the question number 4, which is, do you often feel burnt out or emotionally drained? And based on this, we can see that 104 students respond yes to the question, and university students who frequently engage in avoidance behaviors such as procrastinating or ignoring academic tasks are at higher risk of developing burnout. Avoidance may offer short-term relief from stress or anxiety, but it allows academic pressure to accumulate, leading to overwhelming workloads and feelings of helplessness. Over time, this pattern contributes to emotional exhaustion, a key component of burnout, where students feel mentally drained, unmotivated, and detached from their academic goals. And according to Compass et al., avoiding coping is associated with long-term negative impacts on mental health and functioning. Among students, this often results in a decline in performance, loss of interest in studies, and a persistent sense of failure, ultimately affecting both their well-being and academic outcomes. And for question number 5 is my go-to stress reliever are mostly student answer the listen to the music because music has the power to influence emotion, provide comfort, and even being a sense of escape from the stressful situation. It also a very personal and accessible form of relief that does not require much effort or social interaction, which may be appealing for those who prefer solitary coping mechanism. While for other commonly chosen methods, including watching television or reading a book for fun, 34 respondents respond to this, and this result indicate that people rely on both solitary and social forms of coping, depending on their personal comfort and availability of support. And this data shows that while individuals recognize the importance of rest and relaxation, there is still a strong tendency to internalize stress rather than seeking the support. And move on for the last part, which is section 3, talking about the practice. So for question number 1, rank this negative stress in order how often you experience it. This present data on how frequently respondents experience various negative stress, namely lack of focus, headache, mood swing, appetite change, and insomnia. Among these, lack of focus emerged as the most commonly reported first choice effect, with 36 respondents selecting it as their primary symptom of stress. This indicates that cognitive disruption is a major concern among the participants when they are under pressure. The prevalence of this symptom underscores the importance of promoting mental wellness strategies such as mindful practice, adequate rest to help students improve concentration and academic performance during stressful period. And move on to question number 2, which is I've been turning to work on other activities to take mind off things. And according to Elias et al., students who engage in proactive coping strategies, those that involve planning ahead, managing time effectively, and engaging in positive activities tend to achieve better academic results and experience higher life satisfaction with lower level of anxiety. One form of proactive coping includes turning to healthy distractions such as exercise, hobbies, listening to music, or spending time with supportive peers. These activities help students momentarily detach from academic pressure and recharge mentally, allowing them to return to their work with improved focus and emotional balance rather than avoiding tasks entirely. Such diversion, such as constructive emotional regulation, which is a way to prevent overwhelm and burnout while still maintaining control over academic responsibilities. And for third question, do you avoid procrastinating and stick to the study plan? And this pie chart shows that there is an equal split in responses, with 50% of participants state that they avoid procrastination, while other 50% admit they do not. This balanced outcome highlights that procrastination is a significant challenge for many students. The high percentage of those who struggle to maintain a study plan can be attributed to several factors, such as academic overload, stress, and anxiety, often push students to delay tasks as a way to cope with pressure. Additionally, the lack of this self-discipline or time management skills may make it difficult for some students to stay consistent. And overall, this finding emphasizes the need for better support system such as time management, workshop or stress reduction techniques to help students overcome procrastination and build more effective study habits. And for question number 4, are you supported by friends and family? According to Dyson and Rank, female students are generally more inclined than male students to seek emotional support from peers and family members when facing the academic stress. This tendency to openly discuss their struggle can lead to greater emotional relief and a stronger sense of being supported, which may improve their ability to cope with academic challenges. On the other hand, male students may be less likely to share their difficulties, potentially resulting in unresolved academic issues and higher internal stress. In the university environment, support from family and friends play a crucial role in promoting emotional stability, boosting self-confidence, and reinforcing motivation. Students who feel supported are more likely to remain resilient in the face of pressure and perform better academically. And for last question is I manage my time by, and based on the chart, it clearly shows that the highest percentage of respondents, which is 44 individuals, manage their time by breaking their tasks into smaller and manageable chunks. This method stands out as the most preferred strategy among the participants. The main reason this approach is so popular is because it reduces the feeling of being overwhelmed by large or complex tasks. By dividing big assignment into smaller steps, individuals often find it easier to maintain focus, track progress, and experience a sense of accomplishment with each completed portion. And this time management technique is especially effective for students and busy individuals as it promotes better organization, minimize procrastination, and enhance productivity. That's all from our group. Thank you.